3 stretches to work on hip impingement. So hip impingement is when you try to bring your hip up towards your chest or across your body and you feel it pinching in the front of your hip. And this can happen, typically happens because there's either a bony abnormality and or you have an anterior rotated pelvis. So by stretching and releasing the tension in the muscles that are causing that can really make a big difference in how much pinching you're experiencing. Some of the common culprits are the quad. So doing a quad stretch, you can do it in side lying or standing up, where you bring your heel to your butt with your knee pointing straight down from your body to stretch the front of your thigh here. Holding that for about 30 to 60 seconds is great. You can also stretch your piriformis muscle, which is in the back of your hip diagonally from your tailbone to the side here. You can do that with a figure 4 stretch. And this is a stretch that's a little iffy for a lot of people who have hip impingement. So you want to take this one gently. You're going to bring your hand behind the opposite knee and pull gently towards your chest. Depending on how far this hip is this way or this way may create pinching here. So be gentle with it. Allow your knee to move maybe a little bit up or a little bit down to avoid that pinching sensation, and bring it up as far as you can, where you're feeling it just in the back of your hip here, or maybe slightly in the back here, but not feeling it in the front. If you feel it in the front, please adjust your technique. And if you still can't figure out a way to do that without pinching in the front, then don't do that stretch. But the reason this muscle is important is because this muscle, tension in this muscle, the piriformis, will play tug of war with the hip flexor, and the hip flexor is the muscle that's causing that rotation, which is making it pinch the most. And then last but not least, making sure that there's a release in tension in the front of the hip. So this would be the third stretch, or the third exercise would be to use something like hip flexor release ball or the hip hook to provide pressure on the inside of that muscle, your hip flexor, psoas iliacus, so that that muscle will relax and stop pulling the hip forward. And I got lots of videos on how to do that. What's really interesting about this phenomenon is that a lot of people, who get diagnosed with having hip impingement will, think that it's related completely to the bony abnormalities that happen, the cam impingement, and pincer impingement, all kinds of different bony things that have been examined on MRI or on X-ray. But a lot of those bony impingements can be avoided by having the pelvis be in a better alignment. When you have tension here in the front of the hip, the psoas iliacus pulls the pelvic bone forward when you're doing your activities, doing yoga, going for a run, taking care of the kids, what have you. And that rotation forward actually puts you into a little bit of bending, hip flexion. So instead of having all of your available hip flexion, you're actually already partially in hip flexion. So you lose some of that range of motion here before you feel the pinch. When you get that pelvis back into alignment by releasing the hip flexor, it's more rotated backward instead of rotated forward. You have more room basically to bring your hip up to your chest. Now, for some of you with really bad hip impingement, this may seem inaccessible, but if we can get, like say maybe this is as far as you can go, if you can go from here to here by having that tension in the front of your hip released, that can make a big difference. And I'll give you one more bonus exercise, a fourth one that can really make a big difference with hip impingement as well. So I mentioned that rotation forward can really cause more likelihood to have impingement in your hip. So there's an exercise called the realignment exercise where you use your hamstring and your glute to put your pelvis back into alignment. That one can be really great for impingement as well. So for that one, you would put your hand behind your knee of the side that's getting pinched. You would push down against your hand as if you're putting your foot straight down to the floor. It's like I'm kind of trying to do this motion, but I'm resisting it with my own hand. So pushing straight down, activating my hamstring, feel it back here, feel it back here. Holding that for just a couple seconds, and then I'm relaxing, and then pushing again for a couple seconds, and then relaxing, and then again, repeating that 10 times. And that will help pull the pelvis from that forward position back into that back position, which gives you then more range of motion. So I hope this helps you with your impingement. 3 stretches plus 1 bonus one. Let me know if you have any questions. We're here to help.